Urinary catheter insertion.
Check medical records. Review for previous catheterizations. Check for any pathologic conditions that may impair passage of catheter. Check for allergies. Assess for patient's weight, level of consciousness, developmental level, ability to cooperate, and mobility. Assess for patient's gender and age.
Assess for pain and bladder fullness. To perform this procedure, gather the following equipment.
Catheterization kit with sterile drainage bag for indwelling catheter insertion.
Gather soap and water. Collect container for straight catheterization.
Identify patient. Use 2 identifiers. 1. Verbalization of name and date of birth. 2. Check wristband.
Patient's plan of care. Check for size and type of catheter. Use smallest size possible and collect all required equipment.
Procedure. Explain the procedure to the client and then perform hand hygiene.
Make sure to establish a location in the room to set up a sterile field and then provide privacy.
Lower the side rails, raise the bed to a comfortable height, and establish a good light source for the perineal area.
Positioning the patient. For female, supine with knees bent and apart, and for male, supine with thighs abducted slightly.
Wash the perineal area. First, put on gloves and wash the perineal area. Then remove the gloves and perform hand hygiene.
To prepare a sterile field, open the sterile package and then put on sterile gloves.
Set up sterile field exposing the urinary meatus.
Test catheter according to the facility's protocol.
Lubricate the lower portion of the catheter.
Cleanse the meatus. For a female, spread the labia with the non-dominant hand while wiping from front to back with the antiseptic cotton balls held in the forceps. The hand on the labia is not contaminated and holds this position for the rest of the procedure.
For males, hold the penis with the non-dominant hand and wipe in the circular motion starting at the meatus and working down to the glans. Repeat 3 more times with clean cotton balls.
Insert the catheter into the meatus using the sterile hand.
Advance the catheter until urine returns, and then continue to advance it another 2.5 to 5 centimeters.
Release the labia or penis and stabilize the catheter with the non-dominant hand.
If using an indwelling catheter, slowly inflate the balloon, release the hand, and pull back gently.
Note the amount to be inflated.
Pull the catheter gently until resistance is felt.
Remember to connect drainage tubing.
Before securing the catheter to the client's leg, make sure there is room for the catheter to move.
Place the drainage bag below the level of the client's bladder. Make sure that the drainage bag is attached to the bed frame. Do not attach it to the side rail.
Dispose of drapes, equipment, and gloves.
Perform hand hygiene.
Replace the side rail and lower the bed.
Finally, document. Record and report all pertinent information in the appropriate log. Record input and output. Record any pain, inadequate urine output, and discomfort.